We encourage everyone eligible to get their booster. And we want to.
County leaders say they've been getting a lot of questions about booster shots. Good afternoon. Welcome to The Four. I'm Heather Myers.
I'm Carlo Cicchetto. Today, they held a news conference to try and clear up any confusion. They laid out the guidelines on who is and who is not eligible for a Pfizer booster shot and where you can go to get one.
News 8's Kelly Hessedal joins us live from the county building with what she learned today. Kelly.
Yeah, Heather and Carlo, first off, the only people who qualify to get one of these Pfizer booster shots are people who got the Pfizer vaccine. So if you got the Johnson & Johnson or the Moderna vaccine, you cannot get a Pfizer booster shot. The county also told us this.
The CDC recommends the following groups should receive a booster shot of Pfizer. Now, this is going to be in two categories. There's a group of folks where the CDC says you should receive a booster. And then there's a second category of folks where CDC says you may receive a booster.
So here's a list of people that should get the vaccine according to the CDC. People age 65 and older, residents 18 and older in long-term care settings, and people 50 to 64 years old with underlying conditions like cancer, diabetes, heart conditions, weakened immune systems. This is the group that the CDC is most focused on, that they say really needs a booster shot. Now, in addition to that, there's a group that may get the vaccine. In other words, you're eligible for it, so you can get it, but the need isn't quite as strong for those in the should category. So anybody from 18 to 49 years old, underlying health conditions, anybody 18 to 64 with an increased risk due to their job. Now that includes first responders, healthcare workers, grocery store employees, as well as agricultural workers. Now, if you're eligible, where should you go to get your booster shot?
We are now returned to a state of normal in terms of where you go to get a vaccine. So if you think about pre-COVID, where you would have gone to get your flu shot, you might have gone to your healthcare provider, you might have gone to a local pharmacy, or if neither of those were available to you, the county would stand up some flu shot locations and you could go to one of those.
So the county will have some locations where you can get a booster shot, but as you heard Chair Nathan Fletcher say there, you know, we're not going to really see those massive drive-through booster or vaccine sites the way we did when the vaccine was first rolled out. So as he said, try your healthcare provider first, go to a pharmacy, and if you can't, then go ahead and go to one of those vaccine locations. And we're going to have an entire list up on our website at cbs8.com. Heather and Carlo.
And Kelly, what about people who had breakthrough cases, those individuals who are fully vaccinated and caught COVID? What do they need to do? And is there any way to be tested to see if the impact of the vaccines, the strength of it, is lessening in you?
Well, as far as the breakthrough infections go, absolutely, the experts say you will still need to get a booster shot if you are eligible. As for any testing to see if your immune has weakened against the virus, they say there really aren't any tests out there like that. As far as the antibody tests go, the experts today said they're really not accurate, and there's just a lot more that goes into your immune response other than what an antibody test will tell you.
All right, our Kelly Hessedal reporting live outside the county administration building. Kelly, thank you.